Talk about prostate cancer. It is the most common type of cancer in men, and right screenings can really save lives.
Yeah, very important. But now researchers have developed a much simpler tool that can identify the risk for metastatic prostate cancer earlier. So here to talk all about it, of course, we have our medical expert, Dr. Payal Kohli, to walk us through this new tool. Very exciting, right?
Yeah.
Big innovation.
And this is for, like, a lot of men, sadly, are diagnosed later on in their cancer. I mean, it's stage 3 or 4.
That's exactly right. So once you get metastatic prostate cancer, it means it's spread widely throughout the body. We really don't have a way to know who's going to respond to which therapy. So we lump all men with metastatic prostate cancer into the same bucket. We just try, okay, let's see if this works, and then see how their body responds. And so our tools currently are really low burden of disease. Is there a lot of, cancer outside the prostate, or high burden of disease? And that's it. Now, earlier in the course of the disease, you can look at the PSA, the prostate-specific antigen, which is a blood test. How high it is and how quickly it's going up tells you whether or not the cancer is aggressive. You can biopsy and see the aggressive nature. But once it gets outside the prostate, really all bets are off. And we use the same cookie-cutter recipe for all men in terms of treatment. And this is really going to help figure out who's going to respond to what.
So what exactly is this new tool?
Yeah, it's really interesting. And I think this is a trend in medicine as to where we're headed. So what they did is they took 1,000 men who already had metastatic prostate cancer, were given treatment, looked at how they responded, and basically reverse engineered a predictive algorithm and then validated it. So they checked it to make sure that it was performing, to see, okay, if your PSA is this and you look like this going in, are you likely to respond to an androgen blocker, which turns off the testosterone, or are you not? And the ones that are not likely to respond, this would change completely how you think about treating them up front. Because once it comes to metastatic cancer, you have like a small window to really make an impact and to improve survival and improve quality of life. So if you start with the wrong therapy or one that's not aggressive enough, it really does take too long. So I think this is where medicine is headed in general, where you come into my office and you have high blood pressure. I don't just pick out of medicine and guess.
Yeah.
I actually use a predictive tool to say, okay, Sam or Kim, based on your numbers and your family history, you might respond better to this type of medicine.
Interesting.
Isn't that amazing?
Yes.
Yeah.
That sounds so great. That's
I know.
one of the advances we love to hear. I tend to think there's a lot of parallels between breast and prostate cancer, in the sense that, the way it's diagnosed, the way it's screened, and the fact that once, like breast cancer, once it leaves the breast area, that's very different cancer, and prostate cancer. But screening is everything in all of this. And it's harder to get men to get into a doctor.
It is so hard to get men to
And at what age do you start?
So less than 40, they say most men don't need prostate cancer screening.
What if they have a family history?
So that's when we usually think about, sometimes we go about 10 years earlier than your earliest first degree relative got it. That's usually kind of our cutoff for most types of cancers, colon cancer, prostate cancer. But in African American men, even without a family history, because they have a target sign on them when it comes to prostate cancer, we usually start at 40, because they tend to get prostate cancer earlier and more aggressively. And if you have a family history, even if the person had it in their 70s, we do start at 40 for screening most men. So, but average risk men would need screening around the age of 55. Now, there's a huge controversy that says if you're not going to live for 10 years, then maybe you shouldn't get prostate cancer screening, because prostate cancer usually tends to be a slow-growing cancer. So something else might kill you before the prostate cancer does. But I think now we're living longer and longer. So it used to be 70 was our cutoff for saying, okay, maybe we stop screening. But I think now even some of my patients in their late 70s or early 80s, we're thinking about actively screening them because they're very young from a functional standpoint.
It's the best way, right? I mean, I'm going to go home and encourage my husband. Did you get your prostate checked? Are you getting screened?
And PSA is what you start with.
So there's two ways, or 3 ways we screen people, really. So the blood test, the PSA is the easiest one to start with. It's just a blood test. You do it every few years. So throw it on with your physical. And, if you want to talk to Mark about his family history, really what you need to know is your personalized risk to decide, is 40 the right age, or 55, or, even earlier than 40 potentially. The second is to think about a digital rectal exam. We've kind of moved away from this, where the doctor inserts a finger in the rectum, feels the prostate from the back, and if it feels like the palm of your hand, it's soft. If it feels like a knuckle, then you have a nodular prostate cancer. The reason we've moved away from it is the sensitivity is lower. You can imagine only the part you touch, and it has to be big enough to feel. But MRIs now, prostate MRIs are a great way for us to tell if a blood test comes out elevated, is it just the prostate kind of growing, benign prostatic hypertrophy, which happens to a lot of men as they get older, or is it potentially a cancer?
All right, life-saving advice, Dr. Coley. Thank you.
Thank you so much.